Do you have age spots or brown spots on your face? Have you tried product after product or treatment after treatment and they seem to they fade a little bit and they come back? Or have you been jumping from video to video finding the best product for hyperpigmentation? If you have, you've come to the right place, because today we are going to be talking about the best ingredients to look for in hyperpigmentation. However, everyone responds to ingredients and everyone's melasma is caused by different factors. So if you haven't watched that, please watch the 3 myths about melasma in our last video. Hi, my name is Christy and I've been treating clients with hyperpigmentation, acne, and other skin conditions for over 11 years. And so we're going to be talking about and focusing on specific hyperpigmentation ingredients that may work best for you, as well as some treatments. And we'll go into some of the pros and cons. If you have stubborn or more larger areas of melasma and you are not pregnant or planning to become pregnant, or you're not breastfeeding, that these are the following that you may want to consider. And also if your budget allows for it. As I mentioned in my last video, professional treatments are the most quickest and the most effective way in treating especially larger areas of melasma. So the first one we're going to be talking about is lasers. Lasers can be very effective in treating melasma. However, here are some cons, or here are some individuals that may be contraindicated to laser treatments. So the first one is, now we're talking about traditional laser treatments. For traditional laser treatments, if you are a Fitzpatrick skin type 4, 5, or 6, which is the more darker skin types, this may not be beneficial for you. Another thing is because the traditional laser treatments that use heat can cause inflammation. This also is a contraindication and may not be quite as effective. There's also another process that some professionals use after using the laser treatment. It's a skin cooling kind of procedure where they cool the skin right after doing the laser procedure. And some studies have shown that when they've done that, in some individuals, hyperpigmentation can actually come back sooner. And I will link in below to the source of that study. So this study was first published in the Journal of Archives of Dermatology in the September issue, and it was done on 23 Thai women, and the average age was 43. And what they found was that when they did the cooling procedure after the laser, they were 3 times more likely to develop hyperpigmentation 2 weeks after treatment. So if you're considering a laser procedure for your hyperpigmentation, make sure it's not the traditional laser treatment. So my suggestion is if you would like to proceed with looking into laser treatment, I would recommend that you would speak to at least 3 different laser technicians before deciding on if laser is right for you. I am just telling you some precautions that you may not hear from the laser professional. Another recommendation I have is, this is actually based on a couple of my own clients when they went and did some laser treatments. Make sure that ask them if they have a pre-treatment and a post-treatment to prep your skin before the laser, and actually products that they can recommend to reduce the inflammation so not more hyperpigmentation forms later. The second one is chemical peels, and I understand that some of you, just by hearing chemical peels, it scares you, and it should. Make sure that it is an experienced, licensed professional that is administering these chemical peels. I've had some clients buy them online, administer it on themselves, and they actually ended up getting additional hyperpigmentation scars from glycolic acid burns. I actually had one client who had very, very fair skin, red hair, actually porcelain skin, and she used glycolic acid, which when you're a Fitzpatrick 1 and she did that, please don't do that. Please go see a licensed professional in your area, even if it's just to get a consultation to see if you are someone who would work well with chemical peels. Do not do this at home. I see YouTube videos of this all the time, and it's like you're using an acid peel. And then one of the things I asked her was, okay, so did you use a neutralizing solution to stop the burning? And she said, what is that? So that just gives you an idea. So make sure you go see a licensed professional with that, and you can do a series of treatments. The other thing is you need to understand, you don't know how your skin is going to respond to these chemical peels. So you want to start off with something that is not that aggressive. See if your skin responds nicely to that, and then work your way up to the more aggressive chemical peels. Make sure you don't, this is summertime, so even though I'm talking about chemical peels, you should not be doing a chemical peel. There is one that you can use that is very friendly. It is more of a peptide peel versus an acid peel. So don't do any acid peels in the summertime, because that can actually exacerbate hyperpigmentation. And when you do this, you need to have products, they go hand in hand to prep your skin, get your skin ready for the low pH you're about to encounter, as well as anti-inflammatories and calming your skin and hydrating your skin, so that you don't have any more inflammation post treatment. Peels need to be well monitored. Here's another thing. So I've had clients where they started it and their skin started to look beautiful. It literally started to fade away a lot of the patches, and because it was fading, they stopped coming, and they stopped mid-treatment. They stopped coming, and then like 2 years later, they came back and they said, my melasma started to come back. And I said, you didn't finish your treatment. So it's really important that you follow directions of the licensed professional, okay? It needs to be well monitored and well managed. You have to remember, melasma did not develop overnight. It did not develop within a week. It takes years for it to show up on the stratum corneum. By the time you start seeing it on the top layer of the skin, it had already been forming deep down below. So you cannot expect any product or any service to eradicate your melasma overnight. That's just not realistic. So some of the more common ingredients that they use in these acid peels can be glycolic acid, azelaic acid, hydroquinone, Jesner's peel. For those of you who are Fitzpatrick 4, 5, and 6, do not start with an aggressive peel just because your skin tends to not be sensitive. Start with a lower one because you are more prone to hyperpigmentation. It also gives the opportunity for everyone involved, you and the professional, to see how your skin responds days and weeks after the service, and to decide whether to go to do a deeper peel and to move forward. Or if it's too strong, to take it down a notch. Skin lightening and brightening products that you use basically boost the efficacy of the professional treatments that you're doing at home, as well as helping to manage and keeping them at bay when you're at home on a daily basis. So that's where they have to go hand in hand. Now, one of the most common ingredients that you'll see in this is hydroquinone. And hydroquinone is actually a skin bleaching agent. It has been shown to be very effective in a prescription level, which is up to 4%. Hydroquinone has been effective in studies when used in combination of hydroquinone, tretinoin, and a steroid. Now, again, everybody is different, and I know some of you are saying, oh, I'm going to make a comment right here. Okay. Yes, hydroquinone is a controversial subject in the skincare circles because it is outlawed in Japan, the European Union, and Australia, because some studies have shown it's been linked to cancer, it's been linked to problems with the adrenal glands, and some studies have shown that it's considered a carcinogenic agent. The FDA has put in that they want to make hydroquinone outlawed, or they want to ban it. It hasn't yet. So I'm just letting you know, I'm not saying hydroquinone is good. I'm just stating the facts. So please don't attack me on hydroquinone. I'm just telling you what is being used, what's effective, but also the cons of it. Also, they do recommend that if you are planning to get pregnant, if you're breastfeeding, those are contraindications, and if you decide to use hydroquinone, they do not recommend using it extended past the 4 months. So after the 4 months, if you decide to use it, then they do recommend switching off hydroquinone and then using other known lighteners or brighteners, such as vitamin C, kojic acid, licorice root, These are basically tyrosinase inhibitors. So instead of actually bleaching your skin, what they do is they actually prevent the formation of pigments to cause hyperpigmentation. This is not recommended for dark skinned individuals. Okay, moving on. Another one is kojic acid. That's considered a tyrosinase inhibitor. So that is actually a very good alternate to hydroquinone because it not only lightens the skin, it actually inhibits pigmentation formation. It is recommended for those who are sensitive to hydroquinone, but again, extended use of this can also lead to, for some individuals, contact dermatitis. Azelaic acid is a non-toxic fatty acid. It's naturally occurring, and it is a good alternative to people who are sensitive to most lightening agents. And it's been shown to prove to be really effective in treating post-inflammatory hyperpigmentation, especially acne scars. And in some studies have been shown to be as effective as 4% hydroquinone. So the next one is licorice root extract. It is an antioxidant. It prevents oxidation, and it's also known as a tyrosinase inhibitor, so it's also a lightener. The other one that is less likely to cause any irritation, as we talked about before if you've been watching the videos, is niacinamide. So yes, niacinamide is an antioxidant, but the great thing about this, ta-da, is that it actually prevents the melanosomes from delivering the melanin to the keratinocytes. So, and it's also known as a vitamin B3. So not only is it an anti-aging agent, it actually helps prevent pigmentation without the irritation that a lot of the ingredients can, not that it will, it can inflame some sensitive skin types. This one actually also I have found to be better with post-inflammatory hyperpigmentation. So if you have both, this may be one that's kind of combining two in one. So if you don't know the benefits of niacinamide, we actually did a video. So if you haven't seen the 6 benefits of niacinamide, you don't exactly know what niacinamide can do for your skin, then go ahead and click on the link below and look at our anti-aging playlist. So remember, makeup is an art and skincare is a science, and we will go more in depth with products in our series. So thank you for watching.